Today we are looking at mental health. We are looking at management of patients with psychiatric condition. Under this one, I came up with an acronym, ATAPAMSA. The A stands for aims. What is it that you want to achieve at the end of the day as you are managing this patient? One of the general aims that I came up with is prevention of self-harm. The T stands for therapeutic relationship. The relationship should be first be achieved before anything. Nurse-patient relationship is the key thing that should lead to achieving the objectives that you have set. The A stands for admission. On admission, here we make sure that we do things like mental state examination and other investigations like full blood count and RPR. The other investigations that you see that are vital should also be done. The P stands for psychological care. This aspect is very important, since in the first place we managed to have good therapeutic relationship. So the psychological care, which deals with the mind, it will be very much easier for us to explain the condition to the patient and also to the caregiver. The A stands for activity of daily living. Here we look at the aspect of the nutrition. We also look at the aspect of exercise. We also look at the aspect of hygiene, elimination, rest. The M stands for medication. Medication should be given depending with the condition at hand, meaning the 6 rights should be considered: the right patient, the right drug, the right time, the right dose, and the right documentation. The S stands for support. Family support is very important to this patient. Friends also play an important role in supporting the patient, and all in all, the hospital support, meaning as health workers who stay with the patient 24/7 should really support the patient in making sure that he or she suits in the society without hurting self or others. The I stands for information, education, and communication. This is a very important aspect to consider. We have to talk to the patient, educating them on how to care for themselves about the condition. But this should only be done when the patient is in a stable state. The R stands for rehabilitation. The rehabilitation is also known as psychosocial rehabilitation. This is the process of restoration of community function and well-being of an individual diagnosed in mental health. This can only be achieved by collaboration with the caretaker. Thank you very much. Go and pass mental health.